if there's one thing that defines our ability to achieve equality in this country, it's access to health care. It's among the most basic of needs. And Liberals are steadfastly, have always been steadfastly in support of ensuring equal access to affordable, free, in fact, health care right across this country. That's why Michael Ignatieff, the leader of the Liberal Party, has committed to, within the first 60 days of a Liberal government, bringing together the first ministers' meeting to talk about the 2014 agreement. They have not been together in the 5 years of a Conservative government. They have not met to talk about health care. That concerns me greatly. I think the lack of discussion is undermining our system. We have committed to increase and stabilize funding. We have committed to home care. We have already costed out the family care part of our process, which is a very strong program helping families right across this riding in the country, taking care of loved ones with critical illnesses. And we've also committed to a pharmacare drug coverage plan. But we also recognize that in order to sustain our system, we need other reforms. And I'm really delighted with the support we've had from the Canadian Health Coalition, understanding that we need to sustain and increase funding, but we also need to talk about preventative health, public health. That's why we have a nutrition program and education part of our healthcare program, access to sports facilities and athletics, to make sure that we have as comprehensive a plan as possible. In terms of enforcement and user fees, it really is tied together. Sustaining the principles requires enforcement. Liberal government has a strong record of enforcing the Canada Health Act and its principles, and has had a record of withdrawing funding from those provinces who have chosen not to follow those principles.